In terms of our views on smoking inhalation, most recently we know that the CDC has put out evidence to say that vaping has become problematic. But again, I found that within that evidence that the CDC had put out, there was no clear-cut evidence to say that the adverse effects reported were related specifically to the inhalation or the vaping of cannabis, right? It was mixed with e-cigarettes, tobacco, and everything. And I think that news like that, when it's not clear to the public, can then misconstrue within persons' minds about specific treatment modalities and how the product can be administered. Because if we were to accept what the CDC said without doing our own research of the evidence to come up with a proper inference overall, we could be putting women, right, at risk for enduring cyclic pain episodes because of, how their bodies are designed naturally, right? More so than men who don't have to deal with that issue on a monthly basis, right? So that is just an example of, when we speak about the gender issues of the use of cannabis, that is a real discussion, and we really have to look at it in a very fair and transparent way about how we, set guidelines and regulations about how to use cannabis for medical purposes, and to ensure that some of the regulations that we put in place are not barriers, right, to groups of your demographic or marginalized groups who could benefit from using cannabis in a specific way.